Today I want to talk about an important topic: hypertensive crisis. Hypertensive crisis. What does it mean? Your BP suddenly rises. That means you are not checked your BP for some time. So the BP is almost more than 200 systolic, and below it is more than 130 or 120. So today morning at about 4 o'clock in the morning, we got an young man around 36 years of age, young man who went to toilet and he fell there. He fell there. There was a sound, so the wife rushed in. She has seen him in unconscious state. So immediately he was brought to the hospital, to the ICU. I have seen him. So by the time he came to the hospital, he was partly conscious. He was slightly conscious and he was able to recognize things. But he complained he's not able to walk. He's not able to walk. And number two, he's unable to see. He says, I am not able to see you properly. You are looking very hazy. So his vision has come down. His vision has come down, and immediately we kept him on injections to control his BP. BP was 240 by 140. 240 systolic, 140 diastolic. So when I asked his wife, is he taking any medication for BP? She casually replied, yes, he regularly takes one tablet daily in the morning for hypertension. He never forgets it. So there lies the problem. There lies the problem, I'll tell you. Next, we have done CT scan for him. There is some amount of ischemia. That means one part of the brain is not getting blood supply, and his renal parameters, kidney, already there is little damage. His serum creatinine is rising. So kidney damage is already about 50% of kidney damage is there, and eyes, as you know, they have become dim. So he has got some retinal changes in the eye. Eye also is little more damaged. So multiple systems are getting affected in the body. Heart also. The heart is beating at 130 per minute, 130 per minute, very fast beat with changes in the ECG also. So please remember, hypertension is not just taking one tablet. You cannot control. Sometimes it is not easy to control hypertension, BP with one tablet. There are 5 or 6 types of medicines for BP. For example, beta blockers, 1, 2, 3, 4, 5, 6, 7. There are still some more. Beta blockers, for example, atenolol, metoprolol, bisoprolol, people use regularly. So they come in 50, 25 milligrams, 50 milligrams. Some people usually, when they come to me, when I'm checking BP, are you using any tablet for BP? I ask them. So they say, yes, we are using 5 milligram power. They don't remember the tablet name. I use 5 milligram power. I use 50 milligram power. I use 100 milligram power, like that. They don't remember the tablet. But power of the tablet depends on the type of the tablet you are using. So for example, this is 50 milligrams. This is only 2.5 or 5 milligrams. This is only 5 milligrams, like that. So don't judge a tablets by its power. Please, no, it's different type. Okay. So beta blocker, this is atenolol, metoprolol, bisoprolol. They usually come in 20 milligram, 25 milligram, 50 milligram, like that. ACE inhibitors. These are one enzyme ACE inhibitors. So lisinopril, enalapril, they come in 2.5 milligram, like that. Okay, and calcium channel blockers, for example, amlodipine, it comes in 2.55 milligrams. And some ARBs, that is angiotensin 2 blockers. Telmisartan, you must have been knowing it. Telma comes in 40 mg, 20 mg, and olmesartan, that also comes in 20 mg, 40 mg, like that. So central sympatholytic drugs, central drugs, clonidine, it comes in, say, micrograms, for example, 100 micrograms, like that. Alpha agonist, progesterone, of course, it is rare to use. So arteriolar dilators, some drugs are there where they dilate the artery, that is, the artery is dilated. Hydralazine, they come in smaller power only, they come in smaller power. So sometimes a single tablet may not be sufficient. You go to a doctor, he writes a tablet. Please don't stop there, don't go on using the tablet. At least check your blood pressure daily twice. You can check at home, or you can go to the doctor for 1 week or 10 days. If the tablet is not sufficient, then they will add one more, like this. For example, you are using metoprolol, they will add enalapril or they will add amlodipine. So like that, combinations. One drug therapy, two drug therapy, three drug therapy, four drug therapy. Sometimes you may have to use four tablets also. Four different type of tablets. Two in the morning, two in the evening to control hypertension. At any cost, your BP should not be more than 140 by 90. 140 by 90 is the maximum allowed. Don't go beyond that. For example, me, I was using one tablet first 10 years back. Then 3 years back, I had to use four tablets. For two tablet combination in the morning, two tablet combination in the evening, I had to use. Then I started strict diet restrictions, and I have I made some videos in the beginning. Video 1, video 2, video 3 in the beginning. My beginning videos are how I could come out, how I could reduce my BP, how I could control my diabetes, completely abolish my diabetes. All those things I have given in the early videos. So 80% diet, 20% exercise. How you have to modify your diet and little exercise, so that suppose you come from I was, for example, take me, I have come from one tablet to four tablets. Then now in 3 years, I have come back to one tablet again. Now I am using only one tablet. My BP is already always 130 by 80 or 120 by 80, or maximum, if I stress a lot, 140 by 90. So this is how you can control your BP. Don't just neglect it. Please have a BP apparatus at home. Everybody nowadays is having a BP, small BP, electronic apparatus at home. Check your BP periodically, at least once in a week. And if your BP is crossing 140 by 90, you may need a second tablet. Please control like that. Don't land in complications of eyes, complications of heart, complications of brain, and complications of kidneys, and other problems also because of hypertension. So be very, very conscious, very, very, very cautious about this, not to be taken